Okay, so next question is, how will seeing a doctor help my weight loss? Now, again, this is a really valid question because there are plenty of places you can go, fill in, fill in an anonymous, or not anonymous, but fill in a questionnaire, and the medication comes to you without you consulting or your medical history or your case being reviewed by a doctor. So there are a multitude of reasons why having the support and the advice of a doctor could really help with your weight loss on this medication. And we've touched on this already. It's not simply just about eating less. If you don't make changes to what you're eating and how you're eating, how you're living your life, you're not going to get the most out of your medication, and you might not get the results you want. And that might cause you to stop, actually, instead of actually continuing on to the end and getting to that goal weight you want to. So absolutely, we can look at what you're eating, give you some advice, make sure you're getting all the nutrients you need, because your body's like a machine. Well, your body is a machine. In fact, for it to be working, it's best for it to be fueled up and going, and burning the fat that we want to go. You've got to give it all the tools it needs. It needs good nutrients. It needs good hydration. It needs to have enough food to do those functions. So there's lots of reasons why it's important to make sure you look closely at your diet and how you're eating when you're on this medication. I think the second, and one of the other, which I think is quite a key important areas about seeing a doctor when you're prescribed this medication, is the knowledge they have about knowing who it's most suitable for, helping you pick the right one, helping you pick the right dose, and helping you navigate your way along taking the medication. You may be taking the medication and experience something different, and you think, well, is this a side effect? Should I continue the medication? And if you haven't got the support of a medical team around you, who do you ask that to? You don't want to ask Dr. Google, because you might get a load of answers that you don't know, or that might be really unclear or might concern you unnecessarily. So having that support, having somebody help guide you and support you along the medication, I think is a really important part when you're taking, these are prescription medications. They are, to be prescribed and overseen by medical teams who know how to advise you best. And I think that will help you get the most out of your medication as well. And there is, when we look as doctors at people's suitability for a medication, okay, we have a list of things where we know you absolutely can't have it because you've got X, Y, or Z condition, or you're already taking X, Y, or Z medication. But sometimes it's important for us to look at other factors in your health, maybe other conditions that you have that might have a bearing on whether one medication might be better for you than another, or whether we need to monitor something a little bit more closely because you've got a history of something else in your medical history. So there's lots of areas why actually having an assessment and having a discussion with a doctor could help to make sure that you get the most out of your treatment and give you that support. And I think the other thing that we know we all like when we're losing weight is accountability. Somebody checking that we are actually progressing. It's that, you've got that appointment, you've got to check in with somebody who's going to be asking you, how did your weight loss go? And if it didn't go well, asking you why not. You've got to show up to that, and you've got to be accountable. And I think that also helps you to stick to the plan.